I think it's important to show the limitations and not just the fancy side of that I think, when you see communications through social media, you can be biased towards that, because you see some fancy terms and some fancy claims. And it's hard for people that are outside of that industry to capture what's the real benefit and whether it really makes sense or not.
What's the European perspective and zeitgeist on healthcare innovation and emerging technologies in the 21st century? Let's talk all about it with healthcare podcaster and French biomedical engineer Mathieu right here on episode 411 of The Nurse Keith Show. Hey there, this is Nurse Keith. This podcast is about you, your personal professional development, your career, and the healthcare system in the big picture. And I'm here to share education, ideas, diatribes, and informative interviews like today's with some of the most inspiring people from the worlds of healthcare, nursing, technology, entrepreneurship, and beyond. I love having you along for the ride, and I thank you from the bottom of my nurse podcaster's heart for being part of the growing Nurse Keith Nation. And guess what? You can now get CEUs from listening to podcasts. That's right. Since you're listening anyway, head over to rnegade.pro, rnegade.pro, where they're building a library of nursing podcasts offering continuing education credits for you. And you can find me and others at rnegade.pro. Log in, select me or anyone else from the content creator dropdown, and get CEUs, because you know what? If you're listening anyway, you might as well get credit for it. And if you'd like to help other people find this show, consider leaving a rating and review on Apple, Google, Amazon, Spotify. Share the show with others, and you could become a patron at patreon.com/Nurse Keith. I appreciate you all so much, however you would like to get involved and help propagate and disseminate this podcast. Anyway, the show notes will be at nursekeith.com in the drop-down menu, or of course, on any app where you happen to be listening. And as I said at the top of the show, we're here with Mathieu coming to us from Switzerland. He is a French biomedical engineer and a podcaster. And Mathieu, I'm so happy to have you here.
Thanks for having me, Keith. It's a pleasure to be here.
Yeah, so tell us about your podcast, the name of your show, and what prompted you to join in the fun of podcasting.
Thanks for the question. And it's actually an interesting journey. So my podcast is called Impulse, Meeting Healthcare Pioneers. So it invites listeners to meet the people who are advancing medical progress through in-depth conversations about their field of expertise and their personal journey. And the idea behind the podcast comes from, working in the healthcare industry, and I've been listening to these conversational podcasts for maybe like 3 years now, usually quite long formats, like 2 hours, 3 hours, sometimes longer. And it was not related mostly to healthcare. It was like sportsmen or entrepreneurs or artists, that kind of people. And I thought it was always very, very instructional, and you were always, getting like an open window on a new world, and you would have this informal tone where you could kind of like imagine yourself having the conversation. And at some point, I was looking for like different shows that would go into that direction, but I would, kind of provide or invite guests that would be in the healthcare space. And there was a lot of things about digital health, and I think it's still a very trendy space. I myself work in that space. But to me, it was missing the rest, because I don't think that digital health is the solution to every problem, even on the technical side in healthcare. And so I thought I would just, try it out and start with some of the personal connections that I had. So mostly in Switzerland and in Europe. And I also thought that, it would be interesting to see how that goes, to produce an episode, to prepare for an interview, to reach out to the people, convince them to join this adventure. Although like I'd not produced any podcast before, or I don't have any experience in radio or this kind of like talk shows. And that's how it came about almost like a year ago, day to day. I think I released the first episode on the 2nd of February last year.
Yeah, the trailer came out, I'm looking, January 31st, 2022.
Exactly.
Yeah, Impulse Meeting Healthcare Pioneers. And you've covered a lot of interesting things. You've covered wearable technology, like actually smart textiles, which I thought was really fascinating. Your most recent episode is about propelling diagnostics through miniaturization. So there's a lot of interesting technological advances happening out there. And you're a biomedical engineer. So how did you enter that world? What was the impulse, no pun intended, it's the name of your show, to become a biomedical engineer?
Yeah, that's a good question. So I come from a family, my two parents are dentists. So, I mean, we kind of like grew up in that medical environment where we, they would often share with us, what their job was about. We would go from time to time to their working place, and they would have lots of friends, working in the medical field as well. Because, in France, when you want to study medicine, you do like, first year, and depending on your ranking after the first year, you can choose your specialty. You can go to dentistry, to medicine, or other specialties. So they had a lot of friends in common, also working in the medical space. Some were surgeons, some were general practitioners, ophthalmologists, and so on. So we had always been, surrounded by this medical environment. And originally, I thought I would study medicine and also like do this or go down the path of being a dentist, because that's the environment where I grew up in. And, I think it's a very interesting job. It's a very good contribution, bringing back smile to people, enabling them to just to smile, to eat, to talk. So there's like, I mean, the value you bring is really huge. But it's also like, if I would have done that in France, probably we would not have had that conversation today. And maybe I would not even speak English in that sense. So I decided to say, okay, maybe I should go to engineering and find something that would have a link to medicine in a way. So I went for biomedical engineering. I checked a school in Switzerland where I studied, called in French it's called the École Polytechnique Fédérale de Lausanne, which translates to the Swiss Federal Institute of Technology, I think. It's based out in Lausanne. So in the French-speaking part of Switzerland. It's actually like a sister school from the renowned engineering school in Zürich, Zürich, where you have scientists like Albert Einstein studied. And that's where I started, learning biomedical engineering. It was at the beginning in the bachelor's degree, it was lots of like, more like fundamental science, lots of physics, programming, mathematics, a bit of biology, a bit of physiology. And then during the master's degree, it got more specialized towards what was called regenerative medicine. So it was about biomaterials, stem cell technologies. So very much research oriented. But it was, very close to some very interesting technologies that, luckily I had the chance to discuss on the podcast, on different episodes, like episode 13, for example, that talks about organoids. And wow, this new type of technologies, supporting the, let's say, advancing the traditional way of doing drug discovery research. So, and that's how it came about. And then after my studies, I worked in product development in vascular products. So I was working on a new type of balloon catheter that was intended to be used for coronary arteries. So the arteries that provide blood in the heart to keep it pumping. And I worked also for a short time as a field engineer, so in the operational room, to support ablation procedures for the treatment of heart arrhythmia. And yeah.
So a lot of cardiac involvement for
Exactly.
you along the
Towards the
way.
end of my studies, it was a lot about cardiology. And now I'm still in the cardiometabolic space, but I'm now working for a company where I'm part of the digital health innovation team. And so we established a lot of collaborations with different startups in digital health. And yeah, that gave me a good understanding of, how the ecosystem in digital health around, cardiac diseases is structured. And that's a very interesting space.
Yeah. And I opened the show by asking, what the European zeitgeist is around emerging technologies. And what do you find? I'm sure there's many, many nuanced conversations, but if you pull the camera back, the big picture, what are people in the European communities talking about and working on? What's the most exciting things that you feel like are developing in European healthcare innovation right now?
Well, I think it's a hard question, and I don't think I have the full picture. I think it depends on the fields. Like, for example, in digital health, I think there's a lot of things happening, to keep, kind of like patients out of hospitals. So you have a lot of companies working in remote monitoring or enabling this sort of virtual care. So like, synchronous and asynchronous. There are some very interesting startups in that space in France, in Switzerland as well, in Germany too. Like I think the regulatory framework as well in Europe is quite advanced. Like if you look at Germany, they have, I think, a reimbursement framework for digital therapeutics. And it's like, it was the first country, I think, in the world to provide that. So in digital health, there's really a lot of things going on. If you look into like maybe the medtech space, I think I've seen a lot of things around surgical robotics. That was actually one focus topic of episode 2, where I received the CTO from a company called Quantum Surgical. And I think there's a lot of also like emerging companies there and, that intend to compete with some of the big players in your country, in the US. I think that's where the specialty really emerged at the beginning. And then also like more on the, let's say, early or research stage technologies, you have what I mentioned, organoids. There you see like companies like, for example, Roche. They appointed one very famous scientist, Hans Clevers, as their, the head of early research and development, and he's kind of like the father of organoids. He was.
And what are organoids? Could you entertain my ignorance and explain that a little bit? You've mentioned it twice.
Yeah, exactly. So it's like, I hope I'm not an expert, but I will try to to formulate it in a clear way. It's like basically miniaturized versions of our own organs that you can like cultivate in vitro, and you can use them. You can use them to test certain compounds, like, and that basically allows you in some ways to, reduce the amount of testing you need to do on animals. It also reflects much way better, than traditional, let's say, 2-dimensional cell cultures, because there we're talking about like 3D models. And so it's very close in terms of the biology and in terms of the mechanical and chemical cues of what's actually, happening in our own bodies. And so you have like models for, for brain, for, liver tissue, pancreas tissue, like basically everything can be turned into these structures. And then those can be used to, in the early stage of, the drug discovery process, to take some, some key decisions as to which compounds you would like to go and alleviate some of the animal testing on the way.
And when you mention organoids and that they're miniature versions of human organs, I'm, lots of things go through my mind. Are these made of organic cellular materials, or are they made of, human-made materials? How do you make a miniature organ that you can actually use in research?
Exactly. So both actually. So you, in the case of the human ones, I think you have different ways to get some. I think there's one way where you kind of like reprogram certain cells of the body, and then you bring them back to like a premature state where they're not differentiated, and then you can induce, through a sort of mix of different growth factors, you can orient them towards a new cellular path, and then from there onwards, you kind of like end up having these auto-forming structures that are resembling the actual organs that we have. So I think the one model that is quite striking, I think it's for the gut,
Mm-hmm.
where you can really see these, this you basically have, the I'm missing the words, but you really see like all these folds, that our gut has, and you can really kind of like replicate that at a very small scale. And with the two side, you have the apical side and the basal sides, and the biology at the cellular level works in the same way than what we have in our body, and it's quite an impressive piece of technology, and it's quite recent actually.
That's really fascinating. Yeah. So it's a recent technology.
It's quite recent, yeah.
Yeah.
And then you have some big companies in the field like Roche, I mentioned, that I think are putting quite some efforts into leveraging these new technologies to develop new treatments. And I think that would be like one example. But going back to your original question, I think it's like there's like so much things happening in the field of like medical technology in Europe, in the US. It's also like that's what kind of like drove me to to start that podcast, because the main driver at the beginning was to to learn things and to meet along the way some very interesting people who would be willing to share a bit of their knowledge with me, and yeah, so it's kind of like an infinite source of learning.
And you've mentioned Germany, France, and Switzerland so far. Are those three countries where startup culture is strongest, or are we seeing that in other countries as well?
I think at the European level, you definitely have, I think, Germany, you have UK, which is not part of Europe anymore, but they have a lot of startups. UK, Germany, France, Switzerland is a smaller scale, but it's also a very dynamic environment. And you have a lot of established also like biotech and medtech players there. Yeah, I would say I'm not so familiar with, other geographies like Italy and Spain. But I think that, there's a lot going on the western part of the continent. Yeah, that's kind of like my impression. And then you have lots of things, happening in the US, as we mentioned. Like, I mean, North America, in Canada, you have lots of things happening in Asia, like for example, in Singapore, Israel also.
That's right.
Lots of stuff there. Yeah.
Yeah, it's fascinating. And you're interviewing a lot of European innovators and people involved in technologies in your episodes, which are all really fascinating. What's an episode that you feel like is one that would really help listeners kind of understand the goals of your show and what Impulse is all about?
Yeah, I think it's it's hard. I would say maybe check out episode 6. I think it's an episode that has a very strong human component. So it's about a neurosurgeon, Jocelyn Bloch, who's working with quite a known professor from the school where I studied, called Grégoire Courtine. And they're working on the development of a therapy that would ultimately, that already, enables paraplegic patients or patients with a severe section of the spinal cord to walk again. And so she's explaining, how that functions, what kind of implant they're placing on the spinal cord, what are the, the physiologic mechanisms that take place to kind of like reactivate these neural pathways that were kind of like, extinct since the lesion. And it's super interesting because she's extremely humble, and she explains very, very well how it works, what are, the limitations, what are the future developments. And of course, like there's the the human side of it when she shares some anecdotes about certain patients, that, were able to walk again after years. I mean, we're not talking about, they were not able to run for kilometers, but they were able to stand, walk, go up a couple of steps in the stairs. And that's really life-changing. And it's already there. So this would be an example of a very inspiring exchange.
I need to listen to that episode, and that's number 6. And so this is about using exoskeletons, modular exoskeletons.
Not even. That's the interesting part. It's I did one on exoskeletons. I think it was episode 3, but in the case of episode 6, it's really like an implant that they have on the spinal cord in the back, and they have some, and it's coupled to like similarly to pacemakers, where you have a pulse generator that's implanted, I think, at the level of the belly, and this is delivering the electrical stimulations, which coupled to another, I think, some pharmacological substances enables these patients to walk again. And it's very interesting because their technology doesn't only apply for motor recovery of the lower limbs. It also applies for the upper limbs. It also applies for the maintenance of the balance in terms of arterial pressure for people who are like tetraplegics, who have these, whenever you basically verticalize them, they lose, they faint because their body's not able to sustain the increased pressure you're putting on them. So the potential is really huge, and they're really making so much advancements over the past like 10 years. And this is super encouraging. And this is like the kind of like stories that I think are really valuable to share. And, they're quite, in the case of Jocelyn, I think she's quite, they've gone through a lot of mediatic coverage recently, for good reasons. But I think it's still, very much worth it to, give these persons a medium to speak and to share about a bit about their story.
Yeah, I think, failure is always part of technology and technological innovation, because we have to fail along the way in order to learn, so that we can move forward another half step, right? So it can be a few steps back and then a few steps forward. But success stories are very important. We need to see how these types of technologies are affecting the lives of real life people, right? So we can have successful in vitro technologies that we're excited about, and every level of science is fascinating, from very basic lab science to the most, advanced robotics and augmented reality. But we really need to see how it affects people, because in healthcare, what it really comes down to is people. And
exactly.
Do you ever have concerns yourself as an engineer, biomedical engineer, that sometimes we can lose sight of the humans on the other side of the equation when we're so focused on technology? Is there a risk of, losing touch with the human side?
I think it's a very good question. I like personally, or if I base myself on the conversations I've had so far with the guests I've had the chance to meet, and also like the people I know from work or from my studies, I don't think we should be afraid. But then you have recently, I think in episode 15 with Nicola, we talked about Theranos, and you're probably aware of that story in the US. But that's a kind of like a case where, you have, a person who's really kind of like obsessed to develop a new type of technology from scratch. And then, ultimately, I think the patient was not fully in scope from the start. And then, there were lots of, issues along the way, but I don't know if the original intent was really there, to provide something new for patients, and not rather than, coming up with a very advanced technology platform. So no, I think it's a very valid question. I don't have the answer. I think it's important in the point you raised up that not to make people believe that technology is going to solve every problem. And I think most all the guests, I guess, that I've interviewed, they're all fully aware of that, in this, and lots of them, even in very, technologically advanced companies, they were telling me, doesn't really matter. Like if you have the most technologically advanced solution, but the doctors don't use it, the patients don't get to see it, it doesn't really matter.
Yeah. It doesn't have that impact. Yeah. And
exactly.
Yeah.
And then if you think about like the healthcare industry, like so many other things to consider, like, regulatory, you have evidence to develop, like it's all like a very strenuous process. And it's really not just purely about technology. And that's why also like I try to convey in the episodes, I try to also show, what are the good sides of it? What are the limitations? And, for example, in the case of Jocelyn in the episode 6, she's extremely humble. She was not claiming we can make every, paraplegic people walk. It's going to be out there in a few years. It was really not the tone, it was more like, yeah, we're making progresses. We still have, struggles with that thing and that thing. But we have, some ideas of how we can get there. And I think it's important to show the limitations and not just the fancy side of it. That I think, when you see communications through social media, you can be biased towards that, because you see some fancy terms and some fancy claims. And it's hard for people that are outside of that industry to capture what's the real benefit and whether it really makes sense or not.
Yeah. And I think, hype is a big part of a lot of this at times. Elizabeth Holmes and Theranos, she defrauded so many investors, and that was an incredibly important moment for people to note. Someone kind of going about it the wrong way, and and then we have so many discussions about artificial intelligence right now. It seems like it's in the news every 5 minutes right now. So exactly. we have to, be measured in the way we look at these things and know that it takes a long time. And social media and the news doesn't always give us the real story. So we have to, as healthcare providers from this side, we have to really keep a skeptical and critical eye so that we understand the reality of what's happening out there in the world. And
exactly. And, looking at things with hindsight and not just jumping into the first, fancy piece of technology. I think what you're referring to now is like what happened with the release of this ChatGPT. Exactly. And everyone going crazy about it. Like it's making a lot of fuss in the tech industry, I think. And it's interesting to see, how much like, how it's turning things upside down in like a matter of days.
Yeah, it's fascinating. Yeah. Well, when we come back from the break, I'd like to talk about a little bit about podcasting itself and your podcasting journey, your vision of podcasting in Europe, what's happening in terms of its evolution in the European Union, and some other things about your whole journey and your career. So we'll be right back with the second half of episode 411 of the Nurse Keith Show with French biomedical engineer and podcaster Mathieu Chaffard. Hey everyone, let's take a quick pause for the cause, shall we? Thanks for being a valued listener of the Nurse Keith Show. And if you'd like to help other people find the podcast, please consider leaving a rating and review over on Apple Podcasts or Spotify. This really helps propel the show and grow our audience. And I truly appreciate everyone who's already taken the time. And if leaving a public rating review isn't your thing, why not tell a colleague about the Nurse Keith Show by sending them a link so they can listen for themselves? After all, word of mouth is the most organic way for me to reach those who truly need to tune in. So if you'd like to do me a solid, Please consider leaving a rating review or telling a friend or colleague. And by doing so, you'll be helping the Nurse Keith Show reach more and more nurses and healthcare professionals all around the world. Now, let's get back to today's conversation. And welcome back to the second half of the episode. We're here again with friend of the pod and my new friend and colleague, Mathieu Chaffard. Prior to the break, Mathieu, we were talking about ChatGPT, of course, because everybody's talking about it. And we were also just talking about the ways in which we need to keep a critical, skeptical eye on technology and not just jump for the next bright, shiny object. And I think there's a lot of bright, shiny objects out there to get excited about.
Exactly.
But I want to talk about one bright, shiny object, which you and I both love, which is podcasting. So at the beginning of the show, you talked about how you decided to launch Impulse and introduce healthcare pioneers to your audience. And I'm curious first about podcasting in Europe. It's very, very big in the United States. It's, the surveys show that podcasting has grown in acceptance among the American public. And most people seem to know what a podcast is now, which is great. And there's a lot of listening going on, which is wonderful. So what's happening with podcasting in Europe? What do you find is the state of the technology and the medium?
Yeah, I think in a few words, I think we start to catch up basically with with all the activities that's going on in the US already, and I think it's already very much established in your own countries you mentioned. And I think in Europe, it's really starts to, you see so many new independent podcasters trying or, starting their own shows. And even the big ones that are, starting to emerge, they're not that old. Like we're talking about like maybe 5 years from now. So they started, podcasting in 2017. And I think by that time in the US, it was already very much established. So it's really, I think, especially like 2022, it was really booming. Like you had, independent podcasters, you had like startups, you had companies starting their own shows. And also like the whole economy around it got democratized, like it was much more, it's much more common now to, place sort of like audio advertisements. And I think it was, I think it was kind of like copied on the American model, and it's just now being, accepted by, or being endorsed by Europeans. But it's really booming. And I think it's interesting because you see all these new voices coming in, and you have lots of like, niche shows, like mine basically, but it's super interesting because now whenever you want to learn about a subject, you can go like to Spotify, and instead of typing the name of a song, you type in the name of a topic, and then you just see like so many different original content that's being produced. I guess there's a lot of like less quality content as well, of course, but the choice is really increasing, and I think it's good. Like it's interesting.
That's great to hear. And your show is recorded in English, so you have guests on, and you speak English, so you can reach a wide audience. But in Europe, is there a preponderance of shows that are recorded in European languages, so they kind of have a more limited reach among speakers of that language?
Yeah, I mean, I don't think I have like the full picture, but I guess like, for example, I'm French, and like the big, obviously the big shows that work in France are in French. In Switzerland, it's a bit different. Like you have four official languages actually. So it's way more fragmented. I don't know, like there's like, obviously the big shows in English in Europe, I guess, some are coming from obviously the UK, some are coming from the Nordic countries, and I guess there's also some coming from Germany. But I feel like it's kind of like more limited to one geography, of course, due to the language barriers.
Mm-hmm.
Yeah, that would be my impression of it. I don't know if there was like, I wouldn't be able to tell one show in English or maybe like the BBC News podcast that would be, listened to and very much, popular in geographies that go beyond the UK, for example.
Mm-hmm. Yeah, it's interesting. In video, obviously, we have closed captioning, and we can watch videos in any language and have subtitles and closed captions. And, in the podcasting world is a little bit more of a challenge. And, if you want to reach, the largest audience possible, you need the most, you need a common language to work from. So
Exactly,
I can see how that could be difficult for like speakers of Portuguese who, that's a more limited group. You have people in Portugal and Brazil and some other places around the world, but that limits your audience.
Mm-hmm.
And, here in the US, obviously, we, English is our one language, and most of us only speak one. I happen to speak Spanish, which I'm proud of, but Americans are known to not speak many languages. And here you are in Switzerland, where, you have 4 official languages. So
exactly,
that level of linguistic flexibility I've always admired it so much. And, I'm curious, what are some of the things you've learned either about yourself or about the world around you, the lessons you've learned and being a podcaster, and how it's changed your life or enriched your life?
Yeah, I think the first thing is that I think people are more accessible and open than I thought. Like, when I started, when I had the idea and I was preparing for like the first episode, and not even preparing the first episode, like, scouting for like the first guest, and I was really like asking myself, like, am I going to get any answers? Like, will they be interested in that? I don't have any materials to show them. And most of the people, and even until now, like I guess 95% of the requests I sent, they all came back with a positive answer. And really that was like a big learning, because to me, like most of the people, like all of them actually, I really, are, they're quite exceptional from my perspective. And I would not have thought that I would ever have like, the opportunity to sit together with them and discuss some of their work, some of their personal journey, without knowing them before. So that was one thing. And then maybe the second thing is what I wanted also like to work on was like, the way I was expressing myself, orally. And I thought it would be a good way of learning that through podcasting. And I think you can kind of like feel that throughout the episodes, where you feel a bit more comfortable, you put less pressure on yourself. And yeah, I think it gave me like some sort of like personal confidence in, expressing myself or like sharing my opinions that I didn't have before. And that is actually, very useful in my day-to-day life or in my professional life. And now in my upcoming episodes as well. So, yeah, I think also it's very nice to, to have like a sort of like, it's a personal project, outside my work. So I don't have like, I have like a huge amount of freedom, and I really like that, I'm free to choose who I get in touch with, what topic I want to cover. I don't have any pressure in terms of like, a timeline or frequency of episodes and to release. Like I try to be, have like 2 episodes released per month, but it doesn't have to be every 2 Mondays or whatever. And it's nice also to get feedback, from at the beginning, it's like, friends, close relatives, family, and then expands. And then you have, people reaching out to you, saying, wow, what you're doing is cool. You're getting, recommendations in terms of guests. And again, like, just like create a sort of a circle where you're being exposed to so many different people that you would not have had the chance to encounter beforehand. And yeah, and as I said at the beginning, it's people are super open.
Mm-hmm.
It's really it's a very good learning. Maybe yeah, the main one since I started.
Yeah, we can learn a lot about ourselves. And, I started blogging back in 2005, and then and my blog is 18 years old now.
Yeah.
And I started podcasting in 2012, January of 2012. So 11 years ago. And I've always appreciated what I see as on some level, the democratization of media and how we can all become journalists if we want to. And,
Mm-hmm.
we're not all professionals, but if you have something to say and you have the ability to, you don't even need to buy an expensive microphone. And, it's relatively easy to create a platform for yourself. And if you have something to say or you want to highlight other people, you can do it. And
Mm-hmm.
I think that's an exciting way of disseminating information. And you and I both, I think, have opportunities to expose our audiences to people they wouldn't know about otherwise. Like
Mm-hmm.
my audience is listening to you, Mathieu Chaffard, and they might not have found you that easily otherwise. So
For sure. Yeah.
I love that cross pollination that can happen, and it's always nice to interview another podcaster.
Mm-hmm.
And so there's personal growth, there's professional growth, and there's also just this window on the world that podcasting gives us. And so people find Impulse on, well, I have it here on Apple Podcasts, but I'm assuming you're on Spotify and Amazon
Yeah,
and
exactly. Spotify, Amazon, Google Podcasts. I think there's also like a couple of other ones like Stitcher.
so all the big players basically.
Exactly. Like if you put the link to the website, which is, impulsepodcast.com,
Mm-hmm.
you have the links to all the major streaming platforms where it's available.
Mm-hmm. Yeah, and you're also on Instagram and Twitter, and you're on LinkedIn. So
And on
we'll have
LinkedIn,
that in the show
exactly.
notes. But I have a question for you. I want to backtrack for a moment to this notion of healthcare innovation. And I have this curiosity that I wanted to ask you. In countries in Europe where taxes are higher and there's somewhat more of a socialist orientation, I'm thinking of places like Holland and Scandinavia where, people don't pay for university and, they get relatively free healthcare. I mean, you pay taxes for it, but these things are available. Are European governments plowing a lot of money into healthcare innovation, or is it more kind of like a private sector endeavor in that particular space in Europe, just overall?
Yeah, no, I think it's a good question. I don't think I have like all the elements to respond, but I think from my perspective, I think in France, I think like now the public, let's say the public funding is trying, to push for that. But I think in the reality, it's still like very much, funded by the private sector. Yeah, I'm not really into, the local, let's say, like in health policy, and I don't know how, all these decisions are being made and what's the exact, what are the exact numbers. But I mean, my impression is that, with all these like, startups in the medical space, or like digital health, in medtech, in biotech, I feel like it's usually mostly driven by private money. And I think now governments are trying, to push a bit more. I think there's like an innovation fund in France, at least, that's quite active in that space. But I wouldn't say that it's that's the actual money pot that's driving the whole innovation there.
Yeah. I was curious how that's developing in Europe. I just wanted to backtrack and ask you that question. Speaking of questions, I have 4 quick ones I like to ask all my guests. Are you game for a little lightning round?
Yeah, sure.
Yeah. Okay. So my first question is, how do you define success, either personally or professionally?
I think it's when you manage to, to help people.
Hmm.
So if you see through the podcast prism, or if I see through like the impulse prism, um, that's when people tell you, oh, I learned this new thing, or I came across that company that it's like close to my field of working. And
Hmm.
yeah, I think it's super interesting, and it's super nice that we got like all these insights through the conversation that you had. It's really, yeah, when you help people. I think again, like when I started my like the podcast, the intent was not to make something, that would be listened by, millions of people.
Hmm.
It was more like to learn new things, to meet inspiring people, and to inspire others, along the way. And yeah, but even like, in my job and in my personal life, I think it's, yeah, if you have that feedback that, someone is like being thankful to you because you've helped them in some way, that's it.
I think a lot of my listeners would agree because most of them are nurses. So that's
Exactly.
part of their, their reason for being, right?
For sure.
And speaking of inspiration, could you name or just describe someone who's really inspired you in the course of your life? It could be a famous person, someone none of us would have heard of, or they could be living or dead. Just someone who's had an impact on you.
Yeah, I mean, I just think a bit. I think like one that people won't know, but I know very
Hmm.
well is like my mom. So she has a very interesting story. She has Vietnamese origins, so she came to France when she was 12, not speaking the language, and just finding her way with, I think, five siblings. They were raised by her uncle because her parents like died of a short time after she moved to France. So she has a very inspiring story, and she's definitely one of the figures I really look up to.
Hmm.
Um,
That's
and then
nice.
on the known side, if there would be one person, or I don't know, maybe like a fellow podcaster that's actually very, very known in the US that I listen to quite often is Professor Huberman in Stanford
Hmm.
with the Huberman Lab. I think what impresses me is like, I mean, the way he expresses himself, the amount of knowledge he has, and the way his podcasts are made. So I think I have the impression it's like, one shot takes, especially the beginning of the series where he's just like talking about science and, giving some practical insights and tips on how to improve your health or your let's say mental capacities through like science-based tools and,
Hmm.
and resources. I think it's like super valuable, and just the way he does it, like the way he expresses himself, the way he articulates his ideas,
Hmm.
the way everything is backed by very concrete science with references and so on. I think it's so well made, and yeah, I always think it's quite impressive. Also, like now the way he's running these interviews.
What's the name of his podcast?
I think it's called Huberman Lab.
Hmm. I'll have to find that one.
Yeah, I think it's Huberman Lab.
Hmm. I'll look for him. Yeah. So my third question is there a book or a movie? It doesn't have to be an absolute favorite that's had an impact on the way you think or the way you live your life.
Yeah, there's been many. I think one that comes to my mind is Quiet by Susan Cain.
Oh, yes.
Yeah, that was a very good and interesting one. Like, so I'm also like, so it's about, for those who do not know, it's kind of like a book explaining, the science behind people who are introverts and people who are extroverts, and and all the different let's say profiles within the spectrum. And yeah, I mean, to me, it was quite kind of like, very interesting because I really recognized myself as an introvert person in the book. And the person, so Susan Cain, I think she used to be a lawyer, or she was working in the legal space, and she was
Hmm.
also like very much introverted. So she shares a lot about, the impact it has had on her career and on yeah, on her personal journey.
Yeah. I need to read that book for sure.
It's really interesting.
Yeah, it's about the power of introversion in a noisy world, which I think is,
Yeah, exactly,
yeah,
exactly. And
yeah.
I mean, I work in a big company, and you can see these things. Like sometimes you have the impression that people who are the loudest, have better chances, or it's interesting. I think there's a lot of like natural biases that we have as humans,
Hmm.
that influences our ways of taking decisions and so on.
Hmm.
But it's a super interesting book, also like very much science based, and very clearly, framed, and
Mm.
um,
Yeah,
very recommendable.
I have to put that one on my list for sure. Okay, last question. If
Mhm.
you were elected king of the world, what's one of the first things you would want to do to improve the lives of your subjects? One thing you would like to do. First thing.
Whoa, that's a big question.
Yeah,
Um,
yeah.
no, I think I would either, provide like good health for people across their like, their lifetime to
Hmm.
everyone, or I would do like something like, alleviating hunger, or like something that has a very high impact on certain problems that we still face in our world, that sometimes I
Hmm.
kind of like wonder why, when you see the amount of resources that we have at hand. Um, yeah, that would be, I think, in that direction. Maybe it's a bit of a trivial answer, but that's what comes to mind.
I don't think that's trivial at all. No, several other guests have said they would go with food, clothing, and shelter. They would go with the very basics first, because
Really,
so
really.
many people lack water and access to food and
Yeah.
access to
Hmm.
housing. So no, I wouldn't say that's trivial at all. I
Hmm.
think it's beautiful. Well, Mathieu, I really want to thank you so much for reaching out to me. And I love your show. It's impulsepodcast.com, and you can find it Impulse Meeting Healthcare Pioneers on Spotify and Google and Stitcher and Apple. I just think it's wonderful, and thank you so much for adding your voice to the you know to the conversations that are happening about healthcare innovation. And thank you for being here.
Thank you so much, Keith, for the opportunity to share my story. It's interesting to be on the other side of the microphone, and
Yeah,
yeah, I really also, supporting your activity. And it's, to me, it's impressive that you've been doing podcasting for like, more than 11 years now. So
thank
you
you,
surely have a lot of things to teach me as a newcomer in this space.
thank you so much. Well, there you have it. Thanks for listening to this episode of the Nurse Keith Show. Remember, the show notes will be at nursekeith.com. And please check out Impulse Meeting Healthcare Pioneers on any podcasting app, or impulsepodcast.com. I hope you feel uplifted, empowered, and informed from this episode. And if you need personalized holistic career coaching for your nursing and healthcare career, check out Nurse Keith Coaching at nursekeith.com. Mention the show and get 10% off your first coaching package. And go to rrenegade.pro if you'd like to earn CEUs for listening to podcasts, because you're listening anyway, so why not do that? We are a proud member of the Health Podcast Network at healthpodcastnetwork.com. We're produced by Rob Johnston of 520R Podcasting, and Mark Cappy-Speason is our social media ringmaster and newsletter wrangler. Before we say goodbye, I'll leave you with this quote by Albert Schweitzer: "Success is not the key to happiness. Happiness is the key to success. If you love what you're doing, you will be successful." Be well, dig deep, seek joy, keep in touch. This is Nurse Keith saying adios till next time from beautiful Santa Fe, New Mexico, and Mathieu Chaffard saying adieu from
Zurich.
Zurich, Switzerland. Thank you, Mathieu. Thanks to everyone for listening, and we will catch you on the proverbial flip side.